Hello, my name is Syra. I'm student physical therapy assistant at CBD College. So today I'm going to discuss multiple sclerosis. Who's going to get it? What is it? Symptoms, diagnosis, and treatment. So I'm here to provide some information regarding MS. So MS is a disorder in which our body immune systems attack the protective covering of the nerve cells in the brain, which include the optic nerve and spinal cord, and it's called myelin sheaths. So this myelin sheaths, it's often compared the insulation in an electrical nerve. So when the covering sheath is damaged, it exposes the actual nerve fiber, which can slow or block the signal in is being transmitted within. So the nerve fiber themselves might also get damaged. The body can repair the damage to the myelin sheath, but it's not that perfect. So the resulting damage leaves lesion are scars, and this is where we come from the multiple sclerosis, multiple scars. So there's a different type of MS. There's a relapsing remitting MS, secondary progressive MS, and primary progressive MS. Relapsing remitting MS, which is the most people with MS have relapsing remitting type. They experience period of new symptoms of relapse that develop over days or weeks, or usually improve partially or completed. Cycles of acute worsening of neurological function followed by periods without disease progression or seen improvement in symptoms, may even see full recovery of symptoms during remission stage. The secondary progressive MS, which is at least 20 and 40% of people with relapsing remitting multiple sclerosis, actually develop a steady progression of symptoms. The progression come with or without periods of remission and happens within 10 to 40 years of disease onset. This is known as secondary progressive MS. The worsening of the symptoms can usually include trouble with mobility and walking. The rate of disease progression varies greatly among people with secondary progressive MS, begins with relapse remitting course, followed by progression of the list of plateau. So the last one is going to be primary progressive MS. So some people of MS experience gradual onset of steady progression of signs and symptoms without any relapses. This type of MS is it's known as primary progressive MS because progressive from onset with or without plateaus or remission period may only see temporary movement. Symptoms. MS symptoms are very depending on the person. Symptoms can change over the course of disease depending on which nerve fiber are affected. Here's the common symptoms of MS, which is include numbness or tingling, lack of coordination, trouble with walking or not being walking at all, weakness, double vision, blurred vision, trouble with sexual, bowel, or and bladder function, fatigue or slurred speech, troubles with memory, thinking and understanding information, move. So the cause of the MS, it's still unknown. It's considered it's immune-mediated disease in which body's immune system attacks its own tissue in MS. So myelin can convert insulation coating and electrical wires when protective myelin is damaged and the nerve fiber is exposed. The message traveling along the nerve fiber may be slowed or blocked. Some risk factors that increase the risk of multiple sclerosis include age, which is 20 to 40 years old of age commonly, and the gender, it's going to be women are 2 or 3 times more likely than men to have relapsing remitting MS. And then if you have any family history has MS or your sibling, higher risk of developing the disease. And some certain infection, which is the variety of viruses, have been linked MSs, including the Epstein-Barr. The Epstein-Barr is the virus that causes infectious monoculus, and then the climate. So MS is far more common in places with temperature climates. This includes Canada, northern United States, New Zealand, and the last two, it's going to be the vitamin D. So the if you're having a low vitamin D of low exposure to sunlight, it's linked to greatest risk of MS because your birth month also may affect chances of developing MS. This is have to do with levels of sun exposure when the mother is pregnant, and also the obesity. People are who are obese or obese in childhood have increased of risk of sclerosis. That's it. Hope it helps. Thank you so much for listening.